Good afternoon, everyone. My name is Sharon Pollock, and I am an Escalate TA coach. Welcome to this office hours on a very important topic. It is my pleasure to introduce Tori Cooper. Tori is a health and equity advocate, community organizer, educator, published author, and leader in the transgender and HIV communities. She leads with more than 30 years of experience at all levels of HIV service, from volunteer roles to her service as executive director and founder of Advocates for Better Care Atlanta, LLC. She now serves as a Human Rights Campaign's Director of Community Engagement for the Transgender Justice Initiative. In this role, her focus includes economic empowerment, capacity building programs, public safety, and expanded public education campaigns. Before joining HRC, Tori was a consultant and prevention specialist at Positive Impact Health Centers in Metro Atlanta. In 2015, Tori created Advocates for Better Care Atlanta, LLC, which is an organization dedicated to the education and empowerment of marginalized people across the country. Since its inception, she has self-financed this agency, which prioritizes transgender women and men, as well as people living with HIV. Tori has received numerous awards for her work and is a published author, most recently appearing in print and video. Her work is featured in a new documentary titled Silent Epidemic, where she talks about the trans community and HIV in the South. She is currently matriculating toward her Master's of Arts degree in public health. Tori believes that empowerment, education, and opportunity are three important factors in success. In 2021, Tori was the first Black transgender woman to be appointed to the President's Advisory Council on HIV and AIDS. It is my pleasure to present Tori Cooper. This will be a really interesting session. I guarantee you all, it's really fascinating hearing from Tori and her background with the transgender community.
Thank you so much, Sharon. That is quite a bio. You make me want to know myself. I am super excited to be here. I wish there were actually more folks here because this is going to be a pretty good lesson. We have about an hour together. This presentation is going to be about 45 minutes, and then we certainly have room for Q&A. You may feel free to include any questions or comments that you have in the chat, and we'll also address some of those towards the end. And there will come a time, you all don't want to hear me talk for an hour. So I'm actually going to invite a couple of you. I'll probably choose your names or have you all to volunteer yourselves, because we're going to do a little interactive activity as well. All right. So again, my name is Tori Cooper. My pronouns are she, her, and hers. And these are your Escalate office hours. And today is Thursday, April 28th. So our objectives for today are really simple. We're going to briefly review some, but not a comprehensive list of best practices for the transgender community. And you'll see the words trans and transgender used interchangeably. We'll learn some key definitions and have a brief overview of some statistics that are specific, especially important for the demographic that we're talking about today, which is transgender women, transgender men, non-binary folks. We'll leave with a few, but not an exhaustive list of clear examples of culturally appropriate engagement, which leads to better retention. And we know that better retention is great because it also generally leads to better health outcomes, undetectable viral loads, all those things that we really, really want for our clients. I love to put this disclaimer here because I am an expert, but I'm not the only expert. Each of us is an expert in our own lived experience, and some of us have a few letters behind our names. I actually finished my master's degree. So that makes us experts, but it doesn't make us the only expert. I'm also a person of trans experience. I'm a Black transgender woman. And so there's also that level of expertise there. But again, I am not the only expert. I'm always open to teaching, but even more importantly, I'm open to learning as well. Words and language are fluid and they're also regional. And what I mean by that is there are some things that folks might say to you let's say okay, so I spend a lot of time in Queens. I have family in East Elmhurst. And there could be some things, some terminology that folks would use in East Elmhurst that would bring the community together that might get you punched in the jaw in Atlanta. And conversely, there's some things and ways that we would describe people and communities and stuff and events in Atlanta, East Atlanta, that would get you punched in the jaw or stabbed in East Elmhurst. So remember, words and language are fluid and they're also regional. That provides a little context. And some of the things that we say may not be the same terminology that you're using, could be, all right? Thirdly, we don't have to agree to be agreeable. Out of mutual respect for each other, we're always going to be agreeable, certainly when it comes to the work and the clients that we serve, but you may not agree with everything that's said here today, and that is completely all right. So I'd like to start off this conversation by talking a little bit about what intersectionality is and how important this is for trans-identified people. We should know about the folks that we're serving. All right, so when it comes to intersectionality is all of those ways that you would describe yourself, all of those different things and aspects of you and your humanity and your community that make you unique and that make you uniquely you. In terms of the folks that we're talking about, transgender folks who are getting services at the New York Department of Health, race is always going to be an issue. Education levels sometimes is an issue. There's also the issue of sexuality, ability or disability. Age can make a difference. Gender, ethnicity, culture, language, class, weight, location, zip code, access to income, access to insurance. I could go on and on and on. I generally, one way to think about intersectionality is all of the commas that we would use to describe ourselves. For instance, I've already told you that I'm a Black, transgender, woman, who is doing capacity building and technical assistance for the New York Department of Health. So that's 3 things you know about me. I also live in the South, I have a reasonably good credit score, I am a homeowner, I am a descendant of immigrants, also a descendant of slaves, and I could go on and on and on. I am a person, I told you I'm also a college graduate and have a master's degree, I am a person who is not married, so I'm single, et cetera, et cetera. So in the United States, there's this fake archetype of perfection that white cis and all of the systems that we have to navigate really were created for the benefit of white, cisgender, heterosexual, men, of a certain socioeconomic status, who were married. Don't believe me? Be something other than a white, cisgender, heterosexual man who's married of a certain socioeconomic status and apply for credit. Apply for a mortgage. Apply for a credit card, for a driver's license, a gun permit, any of those things, all right? All of the, even the nutritional chart that our children that they use in schools is based on the bodies of white, cisgender, heterosexual men and children. Okay, all of those things. And the further you are away from that false image of perfection, the more problems you're going to have navigating society. And looking at race and class and language and culture and ethnicity and gender and age and ability and sexuality and education and so many other things is one of the things that put the folks who we're talking about today, which is transgender and non-binary people, it puts them at greater risk for falling out of care because systems were not created for our benefit. Going to have many more barriers in society simply for being who we are and our intersectional identities. So a great deal of the work that we're talking about, though we don't often use this term, but we really want to think about the transgender theory as a basis for a lot of the work that we're doing, particularly for this presentation, and why it's so important for transgender people to be trans. There are folks who are saying, well, you could just navigate easier, you could get better access if you just did this, or if you didn't do that. And so the transgender theory reinforces our need for self-realization and self-affirmation. Transgender theory is an emerging theoretical orientation on the nature of gender and gender identity and understanding the lived experiences of transgender and transsexual individuals. For the purpose of this demonstration and this presentation today, transgender describes someone who tells you that they're trans, where transsexual represents someone who has made adjustments to their body based on their transgender identity. Transgender theory is distinct in emphasizing the importance of physical embodiment in gender and sexual identity. Transgender theory integrates this embodiment with the self and socially constructed aspects of identity through the lived experiences of those with intersecting identities. Notice some of the key words here are self and socially constructed aspects of identity through lived experiences. So when I first moved to New York many years ago, I actually live in Atlanta now, but I worked for many years in New York. And when I moved to New York, I was young and impressionable and dumb and naive and from the South and a country bumpkin and really excited to be in the Big Apple. And I applied at 3 different jobs. I applied at Bloomingdale's, I applied at Isaac Mizrahi, and I applied at Donna Karan because at the time DKNY was my favorite stuff to wear, and I've always loved Donna Karan's clothes. And I loved the fact that I knew these 3 particular entities were engaging with folks, and even then 25, 30, almost 30 years ago, I knew that they were inclusive in the way that they hired folks. And since then, I followed all of these. I ended up working for Federated for a very long time. This quote by Donna Karan is really important to me. Wellness is a state of mind, body, and spirit. When the 3 are in alignment, you feel balanced and energized. You have more to give of yourself creatively and to your loved ones. That's what we all strive for. And that's a quote by Donna Karan. I mention that, and I mention this quote specifically because for trans individuals who are navigating HIV care systems, we don't always have the leisure of having our mind and our body and our spirit to be in alignment. Because there's some folks who are going to be cool with the fact that you're trans, but they don't like the body that you're living in, or they don't understand the body. Or they're going to be fine with the shape of your body, but they're not going to be fine with the fact that in your mind, you're something that they don't view as a woman or a man. This is a representation, one of many visual images that we have online about the gender-bred person, and there are a lot of different variations. I chose this one because this one goes a little bit further, and it talks about gender, and it gives you 4 distinct concepts about who we are as individuals and some different aspects about ourselves and our personality and the way that we navigate life. So this gingerbread person, if you look at the left of your screen and you see the gingerbread person, what you'll notice first, what I notice first is the identity and the way that we think about ourselves. Our gender identity is what's in the mind. It is who I believe I am, who I tell you I am. My orientation is who is in my heart, who I'm attracted to, what's in my heart. My sex or sexual organs or sexual orientation in this case has to do with what arouses me or who arouses me. And when we look at expression, you notice expression really encompasses all of those things and even more. My expression is how I present myself to the world. On the right of your screen, you'll see gender identities characterized here in a very, very simple line graph, where at one end you have cisgender women, and at the opposite end, polar opposite end, you have cisgender men. And then you have transgender or trans or non-binary folks falling somewhere in the middle. For many of us, even cis women and even cis men and trans folks, all of us don't always exist in one place on this line. There's some folks who are cis identified, who perhaps feel more trans or less male in the way that their identity and how they think about themselves. And conversely, there are also cisgender women, which means a woman who is assigned female at birth, who lives as a woman. There are also some women who don't necessarily see themselves as all woman all the time. That's kind of how folks are, all right? Janelle Monáe, she's a singer and entertainer, and just this week she identified herself as non-binary, which means that even though she is a cisgender woman, her identity is something other than merely as a cisgender woman. Our gender expression, again, looking at this line graph, you see at one end is feminine, and at the opposite end is masculine. And in between fall androgyny, non-binary gender. It could be a whole bunch of things there, all right? Drag queens even would fall somewhere in addition to, along this line of gender expression. And the truth is, if you are a person who is a cisgender woman, that's a woman assigned female at birth who lives as a woman, and if you've ever worn your man's boxer shorts or a unisex t-shirt or a man's t-shirt or pants or shoes or something out in public, for that particular moment in time, your gender expression is something other than exclusively feminine. For transgender people, the way that we were assigned out at birth and the way that we express our gender don't always align. Your biological sex, at one end you have female, other end you have male. So who determines your biological sex? The doctor or the medical provider or the midwife. They assign you as male or female simply based on the appearance of sexual organs, what they see or what they don't see. That's it. And what we should also know is those of us who work in this area is that 1 out of every 2,000 live births is a person who is born with an intersex condition, one of a multitude of different intersex conditions that doesn't make it easy to always identify this particular child as exclusively male or female. Sometimes that means it could be the appearance of a penis, but no testes. Or there could be the appearance of a vagina, and this person has perhaps distended testicles. So there are a whole bunch, and it could be chromosomal. It may even be a difference that's not necessarily something that you notice at birth, or micropenis, or all kinds of other things. Or this child is born with an enlarged clitoris. So there are all kinds of things. There will be folks, the opposition will say, there's only a man and there's only a woman. Well, we know science is much, much more varied in the way that it creates bodies and it creates flowers and animals and that kind of stuff. And the intersex condition happens really in all forms of life. There's a hermaphrodite, there are plants and animals that are able to either have both, the appearance of both sexes, or neither sex. All right, sexual organs, that is. Some that are able to fertilize themselves, and we know many plants have pistils and stamens, which are the reproductive organs of both masculine, traditionally male, and traditionally female things. All right. So sexual orientation, many of us can understand this concept a little bit more than the others. At one end, you have heterosexual, and at the other end, you have homosexual and asexual. All right. And the truth is, many of us would identify as one or the other, or well, one of these 5 different sexual orientations that are listed here. 5 amongst as many people as they're human beings. We could continue to provide space for folks to identify however they choose to. And I would venture to believe that if we were defined simply based on who we had sex with, that most of us wouldn't just qualify as one thing or another. Because you remember that one night in college? No, the one night in band camp, you know. So for the purpose of this presentation, these are really, really simple ways to think about 3 unique concepts. Gender identity is who I tell you I am, period. That's it. It's who I tell you I am. My name is Tori Cooper. My pronouns are she, her, and hers, and I'm a woman. That's it. My gender expression is how I present myself to the world. I started taking hormonal therapy many, many years ago because I wanted to adjust my body so that it more closely matched up with my mind. My presentation is that of a woman because that's how I navigate the world. I simply happen to be a woman of transgender experience. So my gender expression is woman, feminine, that kind of thing. My sexual orientation is who I'm attracted to, who turns me on, not who I turn on, but who turns me on. I like men. And so I'm a heterosexual woman who happens to be transgender as well. This is a great way to think about the folks who are coming in to see us, that they all have, and all of these can be unique concepts for each and every individual that we see, as well as each and every individual that's on the call. So, transgender, for the purpose of this demonstration, transgender folks could be someone who simply describes themselves as a man, as a woman, as both, as neither. Transsexual, again, you can see it spelled more than one different way. It's not a term that we use very often anymore, but for the purpose of this demonstration, of this presentation, means that I've adjusted my body, because we know that the largest sexual organ that you have is your skin and your body. It more closely matches your gender identity. Drag queen, for the purpose of this demonstration, somebody who dresses up for entertainment. Just a simple way to think about it. RuPaul is a great example. RuPaul tells everyone, I am a big black gay man in a dress. And I only put on a dress if there's a check involved. Entertainment, work, that kind of stuff. Androgyny. One way to think about androgyny is not necessarily masculine or feminine. It could be very masculine or very feminine. It could be so in the middle that no one really can put a name on it. I think of characters, because I'm in my 50s, I think of SNL had a character for years, Pat, where no one was quite sure whether Pat was a man or a woman. Transgender and trans, again, we can use those terms for the context of today's presentation interchangeably, describe someone whose gender identity is different than that which was assigned at birth. I'm hoping that all of you have seen the acronyms, because in public health, we love acronyms for everything. AFAB, which stands for assigned female at birth, and AMAB, which stands for assigned male at birth. Transgender woman or trans man or transgender man and trans woman are the most recognized identities that most of us will come across. However, that's even changing because some recent studies are saying, including through Fenway Institute and perhaps even in the city of New York or in the New York Health Department, is that there are more kids in school that are identifying as non-binary than ever before. Gender. Trans folks, we may identify as male or female, man or woman. And for the purpose of this presentation, we'll refer to us folk as being binary. I'm a woman, that's it. You don't have to second guess it. I'm not going to describe myself as anything other than that. I'm very, very clear in who I am. and the way that I present and navigate in the world. So my existence is very binary. But yet there are a lot of other people who fall under the transgender umbrella who may identify as both male and female, or masculine and feminine, or some who don't identify as either. And we would identify them, folks, so they would identify themselves as being non-binary. So non-binary, and here's another new term for you, gender non-conforming. And you see the acronyms there, because again, public health, we like an acronym for everything. Non-binary and gender non-conforming describes someone who does not fit traditional labels and/or whose presentation may not identify as exclusively male or female. Some of the pronouns might include, but are not limited to, they, them, their, ze, we, us, said, and perhaps even no pronouns at all. Non-binary or gender non-conforming folks may present in different styles of dress on one visit and completely opposite the next visit. So here's where we get to our first interactive part. So I would love to have Crescencia and Julia to both join me. Oh no, let's do Crescencia and Melvin. If you could both join me on camera and on microphone, I would be most appreciative. Hi, Crescencia. Is that a yellow sweater?
It's camel colored.
Oh yes, I love it.
It's a caramel, yeah.
I love it. I love it. Is it?
Thanks, Tori.
It's beautiful.
Thanks.
So my pronouns are feminine pronouns, she, her, and hers. So what are your pronouns?
My pronouns are she, her, and hers.
Wonderful. So tell us, why do you think pronouns are important?
I honestly don't think they're important, but I guess in thinking about medically, you want to know if a person has, different workings of the body so that they know how to treat that patient. So I think that might be the only reason why, but I don't really feel it's necessary.
Thank you. Thank you. That's a little deep. Thank you so much.
Absolutely.
Yes. So tell us, Alex, how are you today? Yes.
Yourself.
Wonderful. I can't hear you.
Oh, you can hear me?
I can barely hear you. Melvin. I mean, we can hear you a little, so if in the interest of time, you can talk and I'll figure it out.
Now, can you hear me?
Yes, you're coming through.
Excellent.
All right. So my pronouns are she, her, and hers. What are your pronouns, Melvin?
I'm a gender fluid, non-binary person, so my pronouns are he, they.
He, they. Thank you. Thank you.
Yeah.
So our pronouns are important to you.
Yes, absolutely. I mean, in general day-to-day life, like I get perceived as male a lot, and it's not always what I feel like. So, and just in the sensitivities of my feelings, like it's important to me just because, I don't always feel male.
Gotcha. Thank you. And I think for many folks, thank you both. I think, and stay on off me for a second. I think many folks, what you just heard was 3 different examples of pronouns, why they are important or why they're not important. All right? Or less important to others. Ultimately, I want each and every one of us to understand, for the purpose of this presentation, pronouns are important because they tell you a little bit about who the person is and how they wish and deserve to be identified. Melvin just identified themselves using he and they pronouns. So nothing else is appropriate. Okay? So thank you both for taking part in that little bit of the exercise, and I might call on you a little later. All right? So Here's a little, again, not an exhaustive list because time is short, but here's a little bit about trans history. And I encourage and implore you all to understand that trans is not new. It just might be new to you. All right. We could go back, literally, trans history using today's terminology goes back to Greek and Roman mythology. It's absolutely amazing. There's Elegbolus and there's Hermaphrodites, and there are all these other folks, and it's really, really incredible. Most of us have just never heard of it. So the term transgendered, it had a D in it. Notice how I said words are both fluid and regional, was first used popularly in 1970 to describe in a movie in 1970 to describe Raquel Welch's character in a movie called Myra Breckenridge. I like to include this in many of my presentations because in 1970, Raquel Welch was considered one of the most beautiful woman in the world. And here she is playing a transgendered person in 1970. And the book was actually written, the book Myra Breckenridge was actually written in, I think it was 1967 by Truman Capote. I've seen some parts of the movie. It's really it's a cult camp classic, but it's really, really quite interesting. All right, because it existed even before some of the folks on this call existed. Lily Elby was amongst the first people in the United States to have a successful gender reassignment surgery in 1930. That's 92 years. Yeah, did I do my math correctly? Yes, it's been a long day. 92 years ago. Something to think about because we think of many of these concepts as being new. And until the previous administration, I can't think of too many times where I heard politicians talking about trans people. You know, suddenly we've become an issue when we have lived longer than even the folks who are making, when trans has been around even longer than the people who are making these really ridiculous, archaic, and disgusting anti-trans pieces of legislation. So here's some things for providers. We all provide some type of service for the trans community. And I want each of you to really think about this from a structural issue. Is your staff culturally diverse? Also understanding that cultural diversity looks very different depending on where you are in the country, depending on where you are in the city or which borough you're in, or even what street or neighborhood that you're in. How and where is your site marketed and to whom? Oh, let me tell you a little bit about cultural diversity. So I am really fortunate. So you won't hear this word. For some people, it's a trigger word. But I have a lot of passing privilege in society. I can walk out. I have a deep voice, but I can walk out into the streets, and most people don't realize that I'm trans. That provides a certain amount of safety. But as a person who has worked at certainly on national levels, but also at the CBO levels, because I look and present a certain way in society, I have been able to have conversations about sexual and reproductive health with women who can't have these conversations with men. Perhaps they're Muslim or whatever, wherever they are, or wherever their culture is, it permits them from talking about sex and reproduction with men. And so as a transgender woman, I've been able to have these conversations with folks. That's where diversity comes in. It allows me to be able to sit in rooms, and each of us has our own bit of cultural diversity, whatever that is, that we represent not just ourselves, but other communities of people as well. Remember one of our first slides was on intersectional identities and intersectionality? So think about where your site is marketed and to whom. If your goal is to engage more trans folks into care at your site, but you're marketing in gay magazines, is it David magazine, the one in New York with the clubs, and all this stuff? If you're marketing David magazine to gay people, trans people are probably not going to see that. What images are in your waiting room? Certainly that can be structural, but it can also be as simple as adding more images that represent diversity. Bathrooms. Trans people have been peeing and pooping since the beginning of time, and the truth is, for some people today, it's a big issue for some, and yet it's a small issue for others. Just allow trans people and everybody to pee and poop in peace. The opposition will have you to believe that trans people shouldn't be able to use the bathrooms. So what are we supposed to do? Pee and poop on ourselves? Providers treat people the way that they want to be treated, and that's with dignity and respect. That's for everybody. Notice I didn't say treat trans people that way, treat everybody that way. Remember, gender and sexual orientation are not the same thing. Who I am and how I navigate the world has absolutely no bearing over who I'm attracted to or who arouses me. Because remember, there are women who like women and women who are attracted to women and women who are attracted to men and women who are attracted to both. There's some women who are attracted to neither. There's some men who are attracted to men, some men who are attracted to women, some men who are attracted to both, some men who are attracted to neither. Your gender has nothing to do with your sexual orientation. You can be who you are and be attracted to whoever it is that you are. Okay, they're non-binary folks who go through the world navigating these same worlds, this very binary world. You're attracted to who you like. Who you like is who you like. I encourage each and every one of us to practice cultural humility at all times. If we do it at work and if we do it at home, then it's just going to go out and clean the whole world up. And two of my favorite principles of cultural humility, one is the commitment to lifelong learning. And if you remember my disclaimer, I tell you I'm an expert because you know I'm an expert, but I also let you know that I'm not the only expert. And so part of cultural humility is critical self-reflection. And another aspect of cultural humility is the commitment to lifelong learning. I can teach you a whole bunch of stuff, but what makes me the most effective at this is being able to shut up and listen also. And so each of us must take that into work. If you're a phlebotomist, then be the best damn phlebotomist that there is, but also be willing to listen to somebody who can help you to stick somebody else even better. Do not impose your views on anyone. This is hard for some of us, especially if we have a lot of letters behind our name, but your opinions don't matter. And that's the truth. Unless you're providing a specific medical opinion based on someone's lab results, your opinions don't matter. You don't like horizontal stripes on me? So? You don't like the fact that I have dreadlocks? So? Dark-skinned people shouldn't wear red lipstick. I've heard all of these things. So your opinion doesn't matter. I don't think trans people exist. So, and most importantly, everybody deserves to get the best care. And that's really, really important because if we're there to do our jobs, then we are reminded of this every time someone comes in. There's some folks who are going to have a really easy time navigating the New York City Health Department system or wherever the system is that you work. But there's some people who are going to have a much, much more difficult time. Perhaps there are learning issues. Perhaps they don't have the same levels of literacy, and they may have a much more difficult time reading signs. Perhaps there are language barriers. Every person deserves to get the best care, whether they're trans or not. But this is especially true for trans people because you don't know the bullshit that we had to put up with before we even got to your site today. Somebody misgendered us on the bus, and then we came from a place for what is it called? What do they call them? RKOs, the places where if you're unhoused that you have to go before you can get an apartment, and there are all of these other things that trans folks a lot of times who are navigating public health systems have to put up with before they even get to a doctor's appointment. So here's a little bit more about the people we serve, and we're actually getting close to the end. So transgender respondents to Injustice at Every Turn, which is a survey, a national survey that went out, we're nearly 4 times more likely to have a household income of less than $10,000, an annual household income compared to the general population. Trans people were unemployed at twice the rate of the general population, and these problems were only exacerbated by the COVID pandemic. According to Injustice at Every Turn, 25% of transgender respondents reported losing a job because they didn't conform to gender norms. A staggering 90% said that they faced some form of transgender-based discrimination. 11% of respondents reported having been evicted due to bias for simply being trans. And according to the report, and 19% reported becoming homeless. More than half reported being harassed at a homeless shelter by residents and staff. At a homeless shelter where folks are, based on our societal standards, are at the lowest of the low already. Nearly 1/3 said that they were turned away altogether simply for being trans or different. And nearly a quarter said that they were sexually assaulted at a homeless shelter. So what do we do now? Here's some very key takeaways that you can use. Again, this is not an exhaustive list, but just some things for you to ponder and some actions that you can take. And I took this slide from Adam Thompson because Adam is absolutely brilliant. So I actually literally took this entire slide from him because for some of us, the thing that's standing in the way from us providing the best possible care for our trans clients and for all clients is policy. So begin by asking yourself, what are we trying to accomplish here? Is the team seeking to create a new policy? Are we reviewing existing policies? Do we want to review all policies? Do you want to create a process for others to review policies? You decide what that's going to look like, and then most importantly, just do it. We have to address the social determinants of health, which I must say the city of New York does better than a lot of other places. In part because if you're a person who is unhoused, the city of New York will do what they can to make sure that you get housing. If you're a person who has no income, you automatically get some type of insurance coverage simply by living in the city of New York. So those are good things. But think about the social determinants of health. And again, this is an exhaustive list, but think about economic stability, regular income. Think about social and community context in the neighborhood and environment that you live in. That has to do with culture, doesn't it? You know, if you're from Williamsburg, that's certainly, if you're from the old Williamsburg, because remember, I'm in my 50s. So if you're from the old Williamsburg, there's a certain community that perhaps you are more likely to be related to. And therefore, there are cultural identities and customs and traditions that go along with that if perhaps you were a person of Jewish descent. Think about access to healthcare and good quality, comprehensive and affordable healthcare as well, and education levels. All of those are social determinants of health, plus a plethora of other things. I often talk about zip codes, and zip codes are really valuable because they provide a lot of information. But what most of us forget is that when you get a piece of mail at home, there's a dash and there are 4 additional numbers to your zip code. Those 4 different numbers tell even more specific information about you. They talk about the street that you live on in a very small area. And that all of those things, they control. Again, I mentioned access to credit. All kinds of different things based on your zip code and your education levels. And these are the social determinants of health and access. So I encourage folks to listen, act, listen, and respond to clients. And one of the best ways that you can do that is by providing surveys for your clients. I encourage all of our sites to make sure that we have anonymous surveys. That's where you're asking folks to provide feedback and then actually pay attention, listen to what they're saying, and then respond. For folks who provide anonymous surveys, there may be an opportunity to follow up with them. But you also want to have client advisory boards or constituent advisory boards or community advisory boards, but some way for the folks who are being served to provide feedback that's going to help determine what your service is going to look like and what your staff is going to look like and what services you offer. I always implore people to follow the golden rule and treat others the way that you want to be treated. That seems like it's old hat, but it often doesn't happen. For those of us who go to church, there's an old saying in church that ushers can't have a bad day. And it's true. For those of us who do this work, you don't have the privilege of having a bad day because somebody else's life depends on it. So this is a great time for any questions or comments that you all have. And we zoomed through this presentation But in the interest of time, I wanted to make sure that we allow plenty of time for questions and comments. This will be a great opportunity for you to provide any feedback or any questions. This is a safe space. I tell people, you know, folks say there's no such thing as a dumb question. I disagree, because if you ask me anything about my weight, that's a dumb question. Hi, Melvin, I see your hands.
Hello. Yeah. So I mentioned earlier, you know, I'm a gender fluid, non-binary person, but throughout my day-to-day life, you know, I get perceived as a cisgendered male. And you know, I'm a white cisgendered male. You know, I have lots of privilege. So how can I use my privilege to leverage others into a place of I don't know, a place of power, so that we're all equal at the table?
So thank you for saying that. And here's an interesting concept about equality. My belief is that equality is not what we're seeking, because equality implies that we all start with the same. And what we know is, depending on where you live in New York or where you're from, because a lot of people that live in New York are not from New York. If you started off in a poor school district, already equality will never work. If you started off in a place that had really, really good schools, equality doesn't work, because you're always going to be ahead of other people as well. Or if your parents have more money, or, you know, or whatever, maybe your parents owned their homes outright and other people didn't. So equality, I don't think, is what most of us are seeking, especially those of us who are what society deems as multiply marginalized. What we're looking for more so is equity. And so as a white person, I hope your goal is equity. I encourage, and let me tell you the difference. Sharon, come on off on your camera for a second. I want you to participate in an activity with me, if you will. And I'm going to give you an example, Melvin, everybody else, of equality versus equity, and why I believe equity is what, even though we use the term equality, we're looking for equity. So Sharon, what size shoe do you wear?
About 10 and a half.
Okay, so I don't wear an 10 and a half, but let's say, who's the head of the New York Department of Health? Who is the boss there?
Julia Cohen would know. But you know
Well,
that
let's
we
say
have
Mayor
multiple
Adams.
sites represented here.
Let's say Mayor Adams is, thank you for that. Let's say Mayor Adams is giving brand new Rihanna by Louboutin tennis shoes away. It's a brand new collaboration, Melvin. It's never been done before, and it costs about $1,500 each. So Sharon wears a 10 and a half. I wear a 12. So Mayor Adams goes out and buys both of us a 10 and a half, right? That's equality. Sharon gets her 10 and a half. It fits her great. I get the 10 and a half. All I can do is wear them as earrings because they won't fit my feet, right? Equity says Sharon gets her 10 and a half, but I get my 12. Now, here's the key, the big part about equity. It doesn't cost Mayor Adams anything more to give both of us what we need. Does that make sense?
Absolutely. Yes.
And so, thank you, Sharon, for playing along. So, what I hope that we're seeking is to have equity. And what you can do as a white person, I live in the South, and white people are fighting tooth and nail, especially white cisgender men are fighting tooth and nail because they feel like they have to give up power to everybody else.
Mhm.
That's not at all what folks are seeking. Folks simply want the same opportunities. And they don't want to be treated like shit in the process. And
Absolutely.
what you can do is make sure that where you work, every person who's coming in there is treated with dignity and respect, and that every person gets what they need in order to get ahead. It's never going to be, there will never be a blanket response that comes for that works for everybody. And that seems like a vague answer, but when you take it to heart, you'll get it. There's going to be some people who need more resources in mental health. There are going to be some people who need more resources. Thank you so much, Julia, who are going to need more resources when it comes to housing. Okay. And there's still
Okay.
other people who need greater access, because I think a lot of the work, what we're talking about is access, is where access and opportunity. There are going to be a lot more folks who need access to regular income. And so figuring out what people need and then providing it based on that, I think is a better way, in my opinion, to achieve parity rather than equality.
Excellent. Thank you. Thank you.
Thank you. I appreciate that. And I have to be honest, I promise you I was a little surprised when you came on camera, because I anticipated Michael Miles was going to be a Black man in his early 40s.
Oh, yeah. I get it a lot, actually.
Thank you. All right.
Yeah.
So one more question, I think. And that's Janelle. Did you have a question? Can't hear you.
Sorry, I'm just coming on camera for the discussion to say hello and thank you. That was a good
Well, I
one.
appreciate it. Thank you very much. Have you enjoyed it so far?
Yes,
Great. Have
very
you
much.
learned anything?
I'm sorry, I beg your pardon.
Have you learned anything new today?
Yes, I like the historical aspect of Raquel Welch, Lily Eby. While you were talking, I actually looked her up, and she died from per Wikipedia though. She died from a uterus transplant. They were trying to transplant.
Yes. Yes,
Crazy.
correct. So, all right, so let's talk a little bit about, because I have to turn this back over in a minute. But Lily Elby, thank you for doing that. See, I like that. That's why we're going to get along so well, Janelle. So Lily Elby actually died from her 5th attempt at having a uterus implanted back in the 30s.
She was 48 and she had done like 4 surgeries in the course of 2 years, and it like is crazy that they were awesome that they were so progressive in terms of like, let's do this, you know, but that's cool. Sorry. Thank you.
It is cool because, again, Pete, there are folks, and again, this is not political. I'm simply stating things the way that they are. All right. So don't report this to Sharon and IMAC and say I was out here talking about the president and all that stuff. But we have to think the last administration brought up transgender folks and some made a lot of mischaracteristics and untruths and blatant lies about who trans people are not and who we are. All right. And there are a lot of folks who fell into it. Trans kids have played sports as long as sports have been around. It just became an issue during the last administration. I told you before, so I'm 52 and I have a birthday in 3 weeks. I'm pretty sure that my entire life I have used bathrooms. I'm pretty sure, I don't remember every time that I've used the bathroom, but I'm pretty sure that as a trans person that I have always used bathrooms. But it became an issue during the last administration. And so we have to remember, what does this have to do with us in HIV care? Because the same stuff that we're hearing, our clients are hearing too. The difference is they're trans identified and they're coming in and they have to carry the burden of this. And then they still have to get poked by a needle. And then they still have to get misgendered when they come into the clinic by the phlebotomist. And then they still have to deal with being dead names for us because we haven't updated their chart yet. And then we wonder why they're having a difficult time staying in care or getting to undetectable violence. All right. So this is a little historical context. I welcome any other questions in my last 180 seconds. Comments. If you don't like it, you can tell me. If you love it, you can tell me. Thank you, Janelle. Thank you, Sharon.
Sorry, this is our CMO, Dr. Kalava, and he was listening, but he wanted to just say hello, I think.
Yeah, I'm not really in this course. You know, we've got some staff because I got other things that I got to see patients. But I've been kind of eavesdropping, and I'll tell you something, it's been great. So definitely, I've been quite impressed. So I'm glad, you know, because we wanted our staff to take this training so that they'd be more competent in our trans health care. And I'll tell you something, it's definitely worth it. But I'll be leaving. But anyway, I've enjoyed it. I mean, you're really a character. So anyway, in a good way.
Thank you, doctor. I will not even attempt to pronounce your name, but thank you very much.
Dr. K.
But the best way you can pronounce my name, just say Kamehameha. I'm the original king.
Wonderful, wonderful. We love that. We love that. And so, and as I turned the mic, and I saw your heart. Thank you, Crescencia. But that's a good example. So, what's the word in Hawaii that they use for transgender folks and in Pacific Island communities?
Well, Hawaiian word is mahu. It's a term we use. Yeah.
I knew that. I just wanted to hear you say it.
Okay.
And
Yes.
Janelle and Dr. K and any of the other Escalate TA sites, just want to let you know that if you're interested in having Tori do this training for your staff, yes, I see Janelle, we can absolutely work that out.
Awesome. I didn't have I guess I know we're a little bit over, but since I don't know, does anybody have anything to say? I just wanted to, I'll just be quiet for not. We talked about bathrooms, and I just wanted, what are your thoughts on how to, because, and this is, myself as a privileged person talking, before it didn't seem like an issue, so to speak. So our patients went to the bathroom that they felt comfortable going. We don't necessarily have the right or like the updated non-genderized signs. We just let it be, but it's kind of become an issue. So how do you balance like persons, wanting to choose, but yet also respecting am I making sense? Kind of like, sorry.
It does make sense. All right. And so here's where, not being political, sometimes you have to choose a side, though. All right. Because silence is also complicitness. If you have single stall bathrooms, there's no reason that it should have male or female or men's room, period. There's really no need in that. And the most recent recommendation from the Biden administration actually discourage against that. So let's make that clear. But then in addition to that, when you have, are you cis or trans? And are you a woman?
I'm a cis woman.
Have you ever used the men's bathroom?
I have. So I just
Should you have been arrested?
Probably. Perhaps. I don't know. Well, when I camp and I really had to go, I was like, hey, anyone in there? I'm going to the bathroom, camping purposes, public park. I have used it. Yes, I have.
So the opposition says that you should have been arrested because you used a bathroom that didn't align with your gender. Okay, that's what they say. That's the basis of the law. Okay, that's what they're proposing. That's what HB2 in North Carolina and all these other ridiculous bathrooms are saying. Simply because of who you are, that you should not be able to use a bathroom, and you should have been arrested for using a men's bathroom. I would dare to say that most women on here have used the men's bathroom simply because our line is usually longer.
Yes.
If you have children, especially if you have your own kid with you, you would take that kid into the bathroom with you. Should that kid then put into foster care because you took that kid into a bathroom? It sounds ridiculous, but it's true. All right. So we have to also remember, again, these folks are peddling really stupid, and I'm using that word in stupid arguments in order to fool people into believing certain things about trans people. All right, it's just that simple. It's just that simple. If you have bathrooms, you can put. It is not. Some folks won't agree with this. I don't think it's a bad idea when you have public stalls if you have a bathroom with multiple stalls in it, to have a men's bathroom and a women's bathroom. I don't think that's inappropriate, but there should also be a space that's equal, that has access for all genders or something similar to that. And or your policy should be use the bathroom that you're most comfortable using. In addition to that, because you've identified that you have used the men's bathroom, did you look at the person's genitals in the stall next to you?
No, but there,
So-
no, because there wasn't anybody in there. And then I went camping wise, like I went to go anyway. So
If there
camping,
was someone in the stall, would you have peeped over to see their genitals?
no. And if there was somebody that said they're in there, I wouldn't have gone in.
Okay. But the bigger picture is if you know what the person's genitals are in the stall next to you, then you should be arrested.
Mm.
I couldn't care less who's in the stall next to me. I couldn't give a shit. Because I'm in there to give a shit. I don't care. Don't care. And you shouldn't either. But remember, those folks are saying that because somebody in the stall next to you has genitals that are maybe different than yours, that one of you should be arrested for shitting in a public bathroom.
Got it.
Sounds
Thank
different. You say it that way, doesn't it?
So we're going, we just went over for a few minutes, but I'm really glad that that's okay, Janelle. I'm really glad that you took that question, Tori. So I want to thank everyone for joining. I hope that you've learned a lot. I hope you found, I'm sure you found Tori's presentation really engaging, and feel free to reach out to your TA coaches if you're interested in having Tori do a presentation to your staff. Hope everyone has a great afternoon. Bye-bye.
Thank you. Bye.
Thank you. Bye-bye.